Hi guys, welcome to the channel. Thank you for joining me and thank you for your continued support. So this is a story that I was going to talk about a couple of days ago, but other things have come around which I thought were slightly more important, so I did those first. But this is something I've actually been wanting to talk about for a couple of days. And this is Wedge Streeting's latest idea to get more care in the community and less care in the hospitals. He wants to move a lot of care from hospitals into the community to make it easier to take the stress off A&E and off the NHS and things like that, which, you know, is a good thing, I think, in certain situations. But there are a couple of caveats to this which I'm a little bit concerned about. So I'm going to show you the article and you can let me know what your thoughts are down in the comments section. Let's take a look. Health workers sent door to door in deprived areas to detect illnesses. Now, the NHS is attempting to ease the pressure on GPs and A&Es by sending a new type of health worker door to door in deprived areas to help detect illnesses before people need urgent care. Community health and wellbeing workers are already deployed in 12 areas of England, with 13 others to follow, in an attempt to improve poor and vulnerable people's access to care. So, you know, on the face of it, you think that's quite a good idea. Each worker will be responsible for 120 to 150 households, usually on a council estate, which they will visit once a month to help residents with money, isolation, housing problems, as well as their health. So this isn't just about health, this is also about other things as well. So they're going to be doing a wide range of care, not just in health. Wes Street and the Health Secretary is examining the scheme as he pulls together ideas to help fix the NHS that may be included in the 10-year health plan. GPs and other advocates of deploying community health and wellbeing officers believe they can help Streeting achieve two of the three big shifts in healthcare: moving care from hospitals to the community and making the NHS a prevention rather than a treatment service. Now, I agree with that. It should be a prevention rather than a treatment service, but it should get both right. It shouldn't just, you know, it can't do both poorly. It has to do both well. People who are visited by such workers seek help in A&E 10% less often than they did previously and seek unplanned GP appointments for unexpected medical problems 7.3% less than before, according to the National Association of Primary Care, which is championing their use. Evidence from the Borough of Westminster, in London even, which became the first place to use the community health and wellbeing workers, showed that people in these households are 82% more likely to attend cancer screening, 47% more likely to get vaccinated, and 82% more likely to undergo NHS health checks, which is good. Cornwall adopted the approach in 23. Findings from there show that taking health support to people in such a proactive way has reduced demand for mental health care, community services, as well as reducing the need for visits by district nurses or an urgent care response team. Again, which is a good thing. Community health and wellbeing workers are not clinically trained staff, so they're not going to be doctors or nurses. They're not going to be health visitors. They're just going to be, I think, just liaisons. So I'm not entirely sure how, in a clinical sense, they can help diagnose. I'm not sure what kind of training they're going to get, but they're going to be recruited from the communities they work in and trained up for the role. I'm not sure what training they're going to get, or how medically trained they're going to be, or, you know, how they're going to be able to detect certain things. But anyway, whether they're just going to be a signpost to where to go, I'm not sure. But in places in England, community health and wellbeing workers work for individual GP surgeries or small groups of them. Marcus McAllister, the NAPC's programme manager, said those helped by the scheme attend A&E less because they get help for minor infections, mental health problems and flare-ups of diabetes and high blood pressure from community-based services. They are supporting residents to access earlier and more appropriate forms of care, often in community settings. They are also helping to address wider determinants of health, like housing, finances and loneliness, which are frequently the root cause of escalating health issues that end up in A&E, which is great. Their job is to build relationships with people in their households and with health professionals and NHS services locally. The chief executive of the King's Fund think tank said, "I recently visited a pilot of this initiative approach, and it exemplifies how the health service can transition from merely treating sickness to preventing it. By visiting people in their homes, healthcare workers can see all the factors driving a person's health, not just the symptoms they might disclose during a GP's appointment, but also underlying issues such as mouldy housing, debt and unemployment. So are these people also going to be looking at people who are claiming benefits to see if they are genuinely claiming benefits? Are they going to be reporting back to DWP? Doesn't say, but And I could be this could be a complete conspiracy theory from my point of view, but I would be wondering, especially when they talk about unemployment, are these basically just people going around looking at the deprived areas to seeing who can get back into work? That would be my concern. But let me know what you think down in the comment section about this. It says this method could be particularly effective for those requiring support from multiple services, as it ensures a more coordinated and well-rounded approach to care. So we're seeing some really encouraging signs about what could happen if you got the right care in the right place at the right time, especially among communities and families where they're likely to become what I call the frequent flyers of the NHS. That's a little bit condescending. Many people go to A&E, for example, because they can't get a doctor's appointment. Many people go because they go to the A&E, or they'll go to their GP and they'll say they're fine, and then they'll get worse and they'll have to keep going back and back and back because they're getting worse, but they're being told they're fine. You read these stories in the news all the time. So there are a couple of things I'm not too sure about with this, but I think if it works well, then absolutely. Let me know what your thoughts are down in the comment section. As always, I'd love to hear your thoughts. And don't forget to subscribe if you've got this far. And I'll see you next time.